Bungoma County is set to drive innovative primary health care within Kenya through concerted effort. The county has developed a pioneering best practices in access and quality of health care that empower the community to live healthier.
Matibabu mashinani to decongest our big hospitals, yani bottom up, waamiraza mjebungaki. Kwa sababu nyingi sasa ndio madaktari kwa ground. Na in the few months to come, hawa madaktari wa ground wanaenda kupewa blood pressure machine.
I'm Doreen Kinanga, the PHC coordinator Bungoma County. I'm a family health clinician. Since we launched our primary health care last year, 2023, the Lusaka Last Mile, we have done a lot under primary health care. Number one, we have established primary health care networks in Bungoma County. As you know, Bungoma County has 10 sub-counties. We have tried to establish 2 primary health care networks, and one, the Kimilili and Webuye West. The Kimilili PCN is functional and is working since last year, November. And for the Webuye, it's still underway because of financial constraint. But we are in talks with partners to try that, to make sure by December it's also working. So for PCNs, we have established 2 out of 10, and we are still in talks with the local partners to try that we are able to establish the remaining PCNs by next financial year.
Remember, Bungoma is a large county, so sometimes patients find it hard to come to the referral hospital for specialized care. So what we do, we organize the peripheral facilities on a specific day, then we take the specialist to that particular place, and then of course the patients have been told, so they come and then they are seen, and we also give a return date so that we are going there every month. We're also having a toll-free number for communication between the clients and our health workers.
One of the biggest challenge towards strengthening primary care for government is limited, or what you call the resource constraints. This might be on domestic allocation and also partner support. Find that whatever has been allocated is not much enough to cater for the available population, which is still growing in numbers, in large numbers in Africa, particularly also Kenya. And as such, it calls upon stakeholders to join hands and support governments towards investing in primary health care. This is a supportive journey towards achieving universal health coverage, which are some of the key commitments by government leaders and also particularly Kenyan leaders. We find that one of the commitments by His Excellency the Governor of Bungoma County, Honorable Ken Lusaka, he has a commitment to strengthening primary health care, and this can be done when appropriate resources are redirected towards primary health care initiatives, and also as partners, we come in very handy to support through monitoring, evaluation, and advocacy, calling upon increased investment and bringing stakeholders aboard. The network is a civil society organization that advocates for strengthening primary health care through monitoring and regulation, and also conducts budget advocacy to ensure that government invest efficiently into primary health.
These will transform the Vital Signs Profile Tool (VSP) into an innovative, data-driven insight into monitoring and improving key health indicators. As such, it has enabled Bungoma County to roll out VSP across all the sub-counties, hence a model for responsive and accountable healthcare. Therefore, the Primary Health Care Network (PCN) will link health facilities with community health workers to offer more coordinated care for patients by bringing services closer to home.
The patients from the community are able to get services through the PCN. The MDT, they're able to do the reverse referrals to to all the communities around that area through the PCN model, and our patients, they're not using the out of pocket to come to the facility. Because of the PCN, they work to they're able to go to the community, and also they're able to go to the level 2 and 3 to make sure that these patients, they get all the services which are not able to get at the level 2 or the level 1 facility and the level 3 facility through the PCN model.
This has come as a result of support that we get from the Ramka network, which have really supported us in, first of all, coming up with the technical working group, which is a key important element in terms of how we're able to sit down and discuss and be able to monitor the indicators. And they are the key partner in terms of coming up with the vital signs profile tool. And we usually have regular quarterly review meetings with them so that we're able to discuss and get way forward out of as we try to plan and monitor and measure the indicators using the vital signs tool. So were it not for the Ramka network, we could not be able to have this kind of innovation in our county as a whole.
The tool is very simple, and anybody, even a layman, can use it. And through that tool, the sub-county, they're able to identify gaps from that tool. They're able to make decision from that tool. And also it's a resource mobilizer. We're able to know how much has been allocated under primary healthcare. We're able to know how much has been allocated under the health department. And we're able to know how can we look for more money to support our health system. Also, this tool is a multi-sectoral tool. It has brought all other departmental heads together, because from that tool we're able to measure all the indicators. Instead of just having malaria indicator alone, they're having their own data review. Maybe you get the Ramka having their own data review. But this one brings all the departmental heads together, because that tool it measures all the indicators under the health system.
However, the health caravan and reverse referral system, which extend healthcare services to the remote areas, provide maternal and child health services, non-communicable and communicable diseases, and health education.
We have a lot of best practice and innovations in Bungoma County since the launch. One of them is the reverse referral. And despite us not having established all the PCNs in Bungoma County, in all the 10 sub-counties, but we have tried to have a best practice on reverse referral by using the PCN model. So make sure that all the specialists from the level 4 and level 5 facilities, they go down to make sure they offer services as an outreach to the spokes. That is the level 2 and the level 3.
Bungoma has an innovation that is the vital signs profile tool. We have used that tool, and it has enabled us to improve in terms of our data, doing vital signs, in terms of managing HR. You know, it enables us to get information that would help us plan on how to take a better care of our patients.
So despite not having all the PCNs formed, but we scaled up the vital sign profile tool to all the 10 sub-counties, and we're able to review it every quarter. So Bungoma County has a primary healthcare data review meetings every quarter, which is also a good practice, which other counties can also learn from it. And also we are also having a TWG meeting every quarter through the data review. Whatever we discuss in the data review, the TWG can also supervise what the data, the members from the PHC data review they are doing. The TWG are able to also to supervise them. And that is also a good thing. And you remember that this tool is an innovation in Bungoma County, and being the only county which has innovated the tool from the WHO. Every patient who comes from the community, at least we have a health center and a dispensary in all the 45 wards, so that patients, There's no need of them coming to a level 4 facility, but can get all the free services at the level 2 and 3 facilities by upgrading and make sure that we have health centers in all the 45 wards. We are planning to digitalize all to do our PCNs through the HMIS system in all our primary healthcare primary healthcare facilities by the support of AMREF. And also we are trying to make sure that all our health centers will have a portable ultrasound, which will help them for early detection in our anomalies, mostly in the RAMCA activities.
These initiatives by the Bungoma County demonstrate a strategic move towards scaling up primary health care for universal health coverage and raising the bar for other counties within Kenya.
We need to engage stakeholders in all whatever we are doing in decision making. And then the second also, I'm supposed to say, the community engagement is key. They need to own everything what we do in primary health care. If you don't engage the community, if you don't engage the stakeholders, there's nothing you'll do under PHC. And what I've also learned is that to strengthen PHC, you need to have a PCN model, and you'll be able to achieve the UHC. The last thing in monitoring and evaluation of our primary health care, we have been using that tool to make sure that we measure the primary health care indicators. And all of this is very important and is very key. So what I can say as a parting shot, that we need all of us as a team to embrace primary health care.